Hello students, welcome to RD Study Center. Myself Rajesh. In today's topic, we are going to discuss about excipient used in manufacture of tablet dosage form. Right? Coming to excipient. What are the excipient? Excipient are the additive substances used in tablet formulation to improve the different properties. So what are the properties? First one, the bulkiness and disintegration, dissolution rate, bioavailability of the drug, of the main drug. If we consider tablet is a drug, right? First one we take a tablet. What are the tablet? It is a solid dosage form. In tablet, mostly we find the API, it is active pharmaceutical ingredients plus excipient, right? Why the excipient is necessary? It will improve the bulkiness when the API is insufficient or smaller in amount for compression. In that case, we need the add excipient which will increase the bulkiness, and also it will improve the disintegration rate of a tablet. What do we mean by disintegration? It is so called the mechanical breakup of a compressed tablet, right? When we form a tablet, it will become it will by method of compression the tablet gets some strength, right? And it is a circular shape. So during contact with water or after ingestion, it need to be break down into smaller pieces, right? Then only it can resolute properly, that is so called as dissolution rate, right? For this breakdown we need to use the disintegrating agent, which is one of the excipient, right? After disintegration it need to be dissolute with the fluid present in our stomach. In that fluid, the tablets granule should be diluted completely. After dissolution, it will be absorbed to the systemic circulation. So it is called this complete process is called metabolism of a tablet dosage form. After absorption, it will be available in our systemic circulation or so-called bloodstream, right? After bloodstream, the blood will be goes to the different tissue or different organs, and where the disease is initiated or the which organ is defected, in that place the drug will be applicable, and we will get the pharmacological action of that tablet dosage form. So the excipient will improve the bulkiness, disintegration, dissolution rate, and finally the bioavailability of a specific drug. So what is the bioavailability? It is the present of dose at bloodstream. It should be 100%. Means when we take a tablet, initially we consider it is 100%. After metabolism in our bloodstream, the main API also available in 100%. Then only we can say the bioavailability of the specific dosage form is 100%, and in that way we can get the better pharmacological action after taking a specific dose, right? So next, the excipient should be non-therapeutic substance. What do you mean by non-therapeutics? Mostly for therapeutic action, we use the API, but excipient, it will support the API to perform the different properties like disintegration property, dissolution property. In that way, we can do better bioavailability within a short time of period, right? So non-therapeutic means it should not show any therapeutic action. Okay, so it is called, we get called it a inert substance. And coming to its objective, why, what are the objectives of excipient? First of all, it will easy the manufacturing process. So in manufacturing we need to make a API, powder API to a tablet dosage form, which is convenient to use for a different patient. What do you mean a different patient? It may be a child or adult, it may be a older patient, right? Depending upon their body physiological conditions and site of action where we need to take the tablet. In previous class, I am telling about the classification of tablet. Depending upon site of onset of action or the route of administration, we can classify different the types of tablets. So in that way, for different type of tablets, we need to the different method for its manufacturing. So in that case, we need to choose the suitable excipient which is applicable for the desired tablet manufacturing, for site specific, for disease specific, and for the patient physiological condition specific, right? So it will finally it will easy the manufacturing process, also improvement in appearance and performance of a tablet. Why appearance of tablet is necessary? Because in case of child case, the appearance matters. Also, every patient should choose the tablet or accept the tablet by its appearance. The performance when it matters, when after taking the tablet within short time of period, we will get the better pharmacological action. Then the patient should be happy or to take that tablet because the disease will be cured after the administration of that specific tablet dosage form. So the appearance and performance of a tablet matters in case of to the patient, right? So apart from that, coming to the different excipients, what are the different excipients available for dosage form manufacturing? So we will discuss one by one. First of all, the diluents or so-called fillers. These are the excipients, binders, adhesives, and disintegrants, lubricants, glidant, flavors, colors, sweeteners, surfactants, and adjuvants. These are the some excipients which we will use for manufacturing of tablet dosage form. We take the excipients with active pharmaceutical ingredients to give a desired shape, size, and weight to a single unique dosage form called tablet. Okay, so moving forward, the ideal characteristics of excipients. When we say an excipient is ideal in nature, so first of all, it should be physiologically innate, right? The excipient should be physiologically innate. Means the physical form of excipient does not affect to the main API, also the patient, and also acceptable to regulatory agencies. What are the regulatory agencies? These are the agencies which will observe the safety efficacy of the different type of dosage forms to the patient, right? In that case, the regulatory agencies should accept the excipient which is used in the tablet dosage form. Also, it should be physiologically and chemically stable, depending upon the different environmental conditions, and in API, different type of chemical substances are available. So in that case, you will not react to that chemical, or it will not react to the packing material of the tablet container, packing material of tablet, right? And chemically should be stable. If it will cause any type of physically or chemically reactions, it will ultimately damage the tablet stability, right? Because a tablet dosage form will long for 2 years of time period or 1 year of time period up to its expiry date. It should be stable and it should be free from microbial contamination. If the excipient is suitable for microbial growth, then it is not suitable for add with API to make a different type of dosage form, because microbial contamination will lead to destroy the stability of the pharmaceutical dosage forms. Also, it will create problems after ingestion to the after taking the patient, right? Rather than cure the disease, it will create some adverse effect because the tablet is contaminated by microbials, right? Moving forward, should not interfere with the bioavailability of the drug, right? If the excipient will hamper the bioavailability of the drug, then we should not get 100% pharmacological action, right? In that case, we choose the excipient which will does not hamper to the bioavailability of the drug substance. If it hamper the bioavailability, then the pharmacological action we expect it will be decreased because of that excipient. Okay, so these are some ideal characteristics of excipient. So having this type of properties in an excipient, we can say it is an ideal excipient, right? Moving forward, the excipient used in manufacturing of tablet. So what is that? First one, diluent. We can say we can discuss one by one with examples, right? What are the diluents? Diluents are the agents, right? These are the agents which will increase the bulk or amount of formulation. We can take a formulation. What do you mean by formulation? Formulation is nothing but the API plus excipient, right? And it will give us mainly we will discuss it at the tablet formulation, right? So the agent which will increase the amount of the formulation, that is known as diluents. When we use the diluents, mostly in case of when the amount of drug is less or it becomes very difficult to compress, then only use these diluents in the formulation, right? It should be non-hygroscopic. What do you mean by non-hygroscopic? Means it should not absorb the water, because when the water is absorbed by the excipient, it will increase the moisture level in that specific dosage form. Also, it will give chances to growth of microbial microbes in that formulation. If the moisture will increase, it will be hamper to the strength of the tablet, and also if the microbial contamination is increased, it will hamper the sterility or the quality of the tablet dosage form. So the excipient should be non-hygroscopic in nature, right? Coming to what are the examples of diluents, we can say some examples of diluents. What are the diluents used in the tablet dosage form? Like first one, lactose, mostly used diluents, and sorbitol, one of the example. Coming to dicalcium phosphate, right? And another one is mannitol and calcium sulfate, also the kaolin. So these are the different type of diluents used in the pharmaceutical tablet dosage form, right? Next excipient is binders. So what are the binders? Binders are the binding agents used in tablet, right? What is its importance? Mostly it will provide the cohesive strength to the powder material. So what will be effect of the cohesive strength? Because of the cohesive strength, the API and the excipient, these both are stick together. Because of this sticking nature, right, it will promote the better granulation, promote better granulation, and finally, because of the better granulation, it will provide, right, mechanical strength to the final tablet dosage form, right? Because first of all, when we choose it is an API or it is an excipient, both are the powder granules, powder materials, right? We need to compact, we need to stick together this excipient as well as the API to stick together. For this sticking nature, we use the binders, so it will improve or provide the cohesive strength between these powder materials, and which will promote the granulation process. Better granulation result in gives the better mechanical strength to the final tablet, right? So here are some examples of the binders. So what are the examples? First one is methyl cellulose, and gelatin, right? Also the starch and acacia and PVP, so-called polyvinyl pyrrolidine. Polyvinyl pyrrolidine. So these are the some examples of binders. So coming towards lubricants, what are the lubricants? Mostly the lubricants are used to reduce the friction between powder mix and the dye valve during the compression and ejection. So mostly in the tablet manufacturing, we choose one dye, right? If think it is a dye cavity, in that cavity the powder material will be compressed. This is the powder material and this is a dye. Here it is in upper punch and here it is in lower punch, right? By some movement in the upper punch and lower punch at time specific, here we think it is in hopper. From hopper, our powder material comes to here, the die cavity, right? These are the powder material we pour here. It will come to the die cavity. And during this compression or movement of the upper punch and lower punch, the tablet will be compressed and ejected as a single unit tablet. The powder material is converted into a tablet, single tablet by this mechanism. So in here, when we need some lubricants, because here the mechanical process going on. Because of this mechanical process, some friction will be generated. When we use the lubricants, the friction will be get reduced and the process will be smoothly carry forward and we can get the fine surfaced tablet at the final result. So, right. Also, it prevents the addition of tablet to the dyes and punches. When we does not use any lubricants, it will be adhere to the dyes and punches the tablet. Right, it will affect the surface of the tablet dosage form. Right. So to prevent that problem, we need to use the lubricants, and also the lubricants will reduce the interparticular friction and thus improve their flow rates. Interparticular friction means the in between the powder there is a friction will be generated during flow, right? Because the tablet or the granules or the tablet manufacturing, the granules should be flow from hopper to the die cavity. In the meanwhile, it will generate the interparticular friction, which will reduce the granule size or generate the powder after granulation also. And so when we use the lubricants, it will be smooth and it will reduce the friction between particle to particle. There may be no chance for breakdown of the granule, and also it will improve the flow rates of the powder granules from hopper to the die cavity. So better flow rate, better the means presence at the die cavity of the powder. After compression, the surface of the powder also smoothened by using the lubricants. So it will be classified into basing upon its soluble characteristics. There are two types: one is soluble lubricants and insoluble lubricants. So what are the soluble lubricants? In the soluble lubricants we can get some example as a sodium lauryl sulfate. In soluble lubricant, we can choose the example as sodium lauryl sulfate and also sodium benzoate, and another one is polyethylene glycol, also called as PEG. These are the examples of soluble lubricants, right? Coming to the insoluble lubricants, what are the insoluble lubricants? It is a stearic acid and magnesium stearate and calcium stearate. These are the examples of insoluble lubricants which is used in tablet manufacturing process, right? The next excipient is glidants. What are the glidants? These are the fine powders which these enhance the movement of powders or the granules from hopper to the die cavity before compression process, right? The main important enhance the flow rate of the powder granules. It enhance the flow rate of the powder granules, which will reduce the weight variation of the tablet, resulting in reproducible result. What is weight variation? If the flow is not proper, then the sufficient amount of granules will not reach to the die cavity. So, because the result will be what will result? It will hamper the strength of the final tablet. Also, the weight of each and individual tablet will not same. It will be different because the flow will be hampered. Due to the hamper in flow, the proper amount of granules will not reach to the die cavity, but the machine is in running, so the compression is done. After compression, the tablet will lose some weight because the poor flow rate. To mitigate that problem, we need to use the glidants, the fine powders, which will improve the flow rate, right? Also, it will reduce the weight variation problem in tablet manufacturing process, right? So, what are the examples of glidants? We can use as a colloidal silicon dioxide, also called is aerosol, and next one talc and cornstarch. So these are the some examples of gradients which will improve the flow rate of the granules, right? Next one, next excipient is anti-adhesive. So what is anti-adhesive? These are the agents that prevent the sticking of tablet surface to the die and punches during compression. When we compress the granules, we need to use this anti-adhesive agents, which will prevent the sticking problem of tablets to the dies and punches, right? So what are the examples of anti-adhesive? These are the liquid paraffin and magnesium stearate, also the stearic acid. So these are the examples of anti-adhesive agent. The next excipient is adsorbents. What is adsorbents? Adsorbents are the used in when the main drug substance is in form of liquid form. If the main drug substance is liquid in or semi-solid form, then we need to add the excipient adsorbents, mostly the volatile oils or liquid extract, right? So why? So what are the examples of adsorbent? So called magnesium oxide and magnesium carbonate and bentonite, also the kaolin. These are the examples of adsorbents, right? Next excipient is sweeteners. So we know that sweeteners, these are mostly used for mask the unpleasant taste of the oral medication. Also, it will improve the patient compliance. So, what are the examples of sweeteners? Mostly, we are well-known sweeteners: aspartame, and dextrose, also fructose, mannitol, saccharin, and sorbitol and xylitol. So these are the examples of sweetness. Next is disintegrants. What are the importance of disintegrants? So it will facilitate the fast disintegration when in come in contact with water. If we take or consume a tablet, after consumption it will go into our stomach. Here there is a water environment is available, right? In that water environment, it will disintegrate. But when we use the disintegrants, it will be fastly disintegrate the tablet, right? Which will facilitate, and the disintegrants will facilitate the easy breakdown of tablet, also the finally release of drug, right? Examples of disintegrants are starch and methyl cellulose. And there are some super disintegrants. For examples, sodium, sodium, starch, glycolate, and rose amylose sodium, right? These are the super in disintegrants. So coming to surfactants, what are the surfactants? Mostly increase the wetting ability of hydrophobic content. In those content are hydrophobic in nature, means water hating properties. In that case we need to use the surfactants. It will increase the wetting ability for that hydrophobic content and enhance the solubility of the poorly soluble drug substance in the GI tract. Also it will finally increase the dissolution rate of the drug substance. So what are the examples of different type of surfactants? So for example, it is a sodium lauryl sulfate. These are the one of the surfactant, sodium lauryl sulfate. Another one is glycerol monooleate, and another one is cyclopyridine chloride. So these are the examples of surfactants used in the tablet manufacturing. And finally, coloring agent, which will improve the appearance of the tablet dosage form. So what are the colors used in tablet dosage form? Mostly the iron oxide and titanium dioxide, also the aluminum flakes. So these are the different type of coloring agent used in tablet manufacturing to improve the appearance of the tablet, also the identification of some specific tablets, right? So thank you students, thank you for your attention and time. I hope you learned something in this session. If you need any other topic related classes, comment in the comment section, and don't forget to subscribe, like, and share. So thank you all.